thank you for coming today for the panel on spirituality and medicine. My name is Dr. Thomas Kelly, and I'm a professor of systematic theology here at Creighton University. I've done a lot of work with travel courses, a lot of work with international learning. I lived at the ILAC Center for 2 years and saw a lot of people who came down to work in healthcare struggle with reflection and spirituality. So I think that's why I was asked to do this. I have a little bit of experience with that kind of stuff. So I'm grateful to be asked to moderate this today. We have 3 wonderful guests that I will introduce, and then they will talk a little bit about their perspective and their work. And then I have 3 questions I pose to them that each will answer, and then we'll kind of open it up. Okay, so that's kind of the perspective. First, I want to introduce Sarah Kelly here on the end. Sarah is a senior medical anthropology and justice and society major in the College of Arts and Sciences and will graduate in May of 2015. She is also a member of the Honors College. During her time at Creighton, Sarah participated in the Water Quality Research Program and the Encuentro Dominicano Study Program in the Dominican Republic. She has participated in 4 service trips to the Creighton Center for Service and Justice, leading 2 of those. Sarah has also been a member of the Service and Justice Trip Core Team, where she helped facilitate Creighton University's Service Trip program. She's also a second-year residence advisor in Keywood Hall, conducting research on energy consumption in Creighton University residence halls. Marcia Shado-Fusick is the chaplain at the Creighton University School of Medicine. Marcia serves as the chaplain for the Creighton University School of Medicine. She has participated several times in the ILAC Summer Health Program and a Project Cura trip to India. She has MA and MS degrees. Phil Garrity is a graduate student of divinity at Boston College School of Theology and Ministry, where he is exploring the intersection of psychology and spirituality in the care of the sick. Prior to his graduate studies, he worked for Partners in Health, a leading global health NGO that helps to strengthen health systems in 4 communities worldwide. Initially headed to medical school in 2012, he decided to withdraw his acceptance shortly before starting at UCLA, only to be diagnosed with a rare bone cancer weeks later. During the following year of intensive treatment, he gained a deeper appreciation for healing that goes beyond a technical quote-unquote fix and cultivates spiritual wholeness of both the patient and the provider. He now speaks and writes on issues surrounding end-of-life care, global health iniquities, and spirituality in the healing professions. So join me in welcoming our panelists. Thank you. So I've been asked to have each of them speak for 3 or 4 minutes on their work and their perspectives, so we'll just kind of go down the line, and then we'll get into the questions.
Okay, so as Dr. Kelly said, I'm Sarah, and I'm a senior here at Creighton. So I guess I'll just start by saying that my spirituality journey has been quite intense in my time at Creighton. When I came here, I didn't really have an understanding or a wish to understand my spirituality necessarily. And I also came to Creighton as a pre-med student at the time, but those are no longer my career wishes, I guess. So when I really began to start thinking about my spirituality was the summer after my freshman year. I went to the Dominican Republic to participate in the water quality program. And there was a junior student who was leading the trip from the spirituality perspective. So what we did as part of water quality was we went into the rural communities called Campos and made sure that the communities there had clean water. And what was interesting to me was to see how the communities were very open and willing to share their lives with us, to share everything that they had with us. And to me, that did not make any sense at all, because I, coming from the United States, had pretty much anything I needed and mostly everything that I wanted. And these human beings lived a very different lifestyle. So a lot of my spiritual questions kind of came from there. And then in terms of healthcare, we were able to see sort of issues that they were facing based on water quality, such as diarrhea, things like that, waterborne diseases, anything. So I began to kind of question, how do you find God in these diseases? So I took that back to Creighton, decided to pursue a career in public health after I graduate, studying medical anthropology. And then I went back to the Dominican Republic again for a semester abroad and really kind of delved into my spiritual understanding, which is something I'm still working on, as I'm sure everybody is but that's kind of my perspective, I guess.
And I'm Marcia Shea McKissick, and I serve as the chaplain in the School of Medicine. I'm not a hospital chaplain. I work with students, faculty, and staff. I would say, as far as my work and the history, and then I'll give you some thoughts on what I think in terms of spirituality. In the course of my work, I spend a lot of time with people that I just mentioned who question why, who are trying to come to terms with trying to make sense of life. When you talk about health care, I think any of us who have ever sought health care, have worked with people who needed health care, there is many times suffering, illness, loss, as well as celebration. And many times the students and the faculty wonder, and you've all heard the phrase, why bad things happen to good people, including themselves. So my role is one of a listener to help the people that I serve come to terms with their own personal spirituality, for them to be able to make sense of their life, what's happening, why it's happening, and then to go forward. Spirituality, as I embrace it, is really the essence of humanity. It doesn't come overnight. It's not quickly figured out. It takes time. It takes conversation. For you to figure out, for all of us to figure out, again, how we're making sense of why things happen the way they do, to explain it to ourselves, to understand it by ourselves, and then at the end to embrace our lives and live the type of life that our spirituality strives for us to live. We have to pay attention to what's going on. We have to figure out how is that affecting me, and then we have to do some reflection on it and move in that growth in terms of our own spirituality. Ultimately, to work on our spirituality, it does take an intellect. And I was thinking about the presentation, and I'm thinking what a fabulous place to be talking about, because Jesuit education always has emphasized intellectual excellence. There's no substitute for using the mind, the heart, the emotions that we've received from God to understand and experience and discover the meaning of life. And I think through my travels, and my witness to people struggling to identify their spirituality, it really is the essence of humanity. It's what connects all of us with what we share as human beings on this planet. That's what I'll say for now.
Thank you. Thank you. Man, that was a lot of good stuff. I think I really agree with Marcia in saying that I think so much of what pervades healthcare and sort of the healing encounter that many people are involved with, whether or not they're physicians, is fundamentally existential, and we could say spiritual or religious, but even without naming that explicitly, in our encounters with patients from all different backgrounds and various degrees of exposure to formal religion, we encounter these same sort of mysteries, which I think that's what I came to learn, not very comfortably or willingly, but it's just that I used to see suffering as a menace, as sort of a rude interruption to life that needed to be removed and eradicated. And I think I took that logic far enough to the point of realizing that suffering, not in a morbid sense, but in a very real way, is inescapable. There is suffering that can certainly be alleviated, and it should. We should be demotivated from doing that, and yet to understand that ultimately we don't have total control over the course or ending of our lives. And I think that sort of relinquishing of control and certainty is a spiritual act. And it's sort of a leap of faith to assume that and trust, that by kind of surrendering that, it's worth it, or that there's something positive that comes out of that, that could possibly come out of that. I wouldn't say in all cases. And I think it's a lot of people can have strong aversion to even talking about spirituality or religion, especially around illness or experiences of adversity in life. And it's often because they think, well, there must be a formulaic answer to explain why this happened or why you're suffering. And I think it's a really humbling but very wise thing to acknowledge that there are no easy answers. And instead of, once again, having that quick fix or that technical kind of intervention, it's more of a journey that needs to be navigated with people and trying to find meaning or make meaning from an experience. And the one other thing I was going to say is that in doing that, the danger is romanticizing illness and trying to sort of see suffering as ennobling, which I think there's sort of a thin line there, because we can probably all attest to the fact that good things can come out of challenging circumstances, but to use that as justification for not intervening or not doing something about them isn't really the way to go either. So I think, especially in this context of talking about global health, it's really important to think about that balance of understanding that we aren't going to fix everything. And yet that shouldn't demotivate us or slow us down from trying to do something well, even if that's just being with people through periods of illness or death. So those are some of my thoughts. More generally speaking.
Thank you. So as part of the moderating of this panel, I was asked to provide 3 questions for the panel. And I thought it would be helpful to sort of give the definition of spirituality that I'm presupposing, because the questions sort of emerge from that. I said that spirituality is how one relates to and understands the self, others, and one's ultimate. So there's a personal and interpersonal and a social dimension to spirituality. I know that's general, but I also believe that we all have a self, we're all in the world, and we all have an ultimate of some kind. So the question is not whether you have a spirituality, the question is whether your spirituality is actually serving you, or whether you're aware of it, and so on and so forth. So along those lines, I asked this question, and we'll let all 3 answer it, and then I'll ask the second one. But the first question was, in your opinion, why is it important for healthcare professionals to practice a spirituality?
I would say that I think it's important for people who work in the healthcare field to practice a spirituality, because they're working and serving a lot of people who have a sense of spirituality, and healthcare professionals also have this wonderful opportunity and privilege to treat people in one of their most vulnerable states, which is oftentimes life or death, or even just illness. So I would say that if they didn't practice a spirituality, they would be missing a greater part of the person who they're serving, and that would make it difficult to treat that person. So something we talk about in medical anthropology a lot is how to serve the greater human being in a holistic way, as opposed to just treating their parts and their pieces. And I would say that healthcare professionals will better serve their people if they can treat them in a holistic way, as opposed to simply treating a heart or a brain or a bone, treating the human being. So I think without an understanding of spirituality for themselves, it would be very difficult to do that holistic treatment.
Thank you.
And I'm looking at the question again. It's very difficult to be present for another person, to answer, or at least try to respond to questions of other people, if we don't have a sense of what it is that we believe, feel, and so forth. I often pose this to students when I'm talking to them is, how are you going to respond when you're in the ER and a child is dying and the parents say to you, "Doctor, why is this happening?" Are you going to go into the science of it, talk about cellular changes? What do you think those parents are looking for? I think they're looking for a deeper answer to that question than just the science or the reasons why asthma does what it does. So personal spirituality to really provide excellent health care, one has to understand their spirituality, why they do the things they do, why they believe what it is they believe. And I think spirituality for healthcare providers not only is the inward looking, how do I identify my gifts, what are those gifts, how do I deal with my own prejudice, my own fears, my own shortcomings. But then when you have to look outside and say, pose the questions that theology and philosophy always pose in subjects like biology and medicine and finance and so forth, to try to understand how the world is organized and why it is. Once you ask those questions, come to know your own spirituality, and then you have a freedom to really practice your profession in a way that will be meaningful and engaging for you.
Thank you.
Yeah, I think when I was thinking about this question, I think I was sort of honing in on the language, practicing spirituality. I think there are a lot of connotations with what that looks like. And I think if you pitch that to a lot of healthcare professionals saying you should practice a spirituality, that might be off-putting. And not to say that we should tiptoe around these ideas or just water them down and use other synonyms, but I think it's important to recognize how fundamental this is, which is kind of what we've all been pointing to, whatever we do want to call it. For me, what I think is so crucial and why sort of the importance of having some sense of a spiritual identity, once again, whether someone calls it that or not, is because for me what it is recognizing, especially in healthcare, that we are engaging with brokenness in people and in the world. And that's a really taxing endeavor. And I think in doing that, our own brokenness gets reflected back to us. And that can be a very uncomfortable mirror, especially in a really direct way, just sensing your own mortality and looking at that very closely in others, but also in terms of just flaws and imperfections. And so I think, to me, that approach to the brokenness we see within and beyond ourselves, that is sort of the demand and the challenge, and also the reward of sort of embarking in a spiritual journey, however you consider that or understand that for yourself. So yeah, I think just this recognizing that reality of the natural tendency to fragment ourselves, and I sort of talked about this in a breakout session I did recently, and how we kind of naturally want to reject certain parts of ourselves. Marcia was talking about prejudice and bias and fear and reactivity that we can have, perhaps very subliminally, right? And how those all play out, especially when we're in environments that are very emotionally charged, as they often are in critical situations of illness, right? So being able to recognize maybe those parts of ourselves that we don't necessarily like, that don't cause us to behave in a way that we like, but actually reintegrating those sort of broken pieces within ourselves to then be able to serve people from a place of wholeness. I think that is a spiritual practice. And I consider that really crucial in healthcare.
Thank you. The second question is, have you personally witnessed the difference between healthcare professionals who have an integrated spirituality that influences the way they practice medicine and those who do not? Can you give any anecdotes or stories?
When I saw this question, I immediately thought back to the research that I did in the Dominican Republic on water quality, and working with people who are healthcare providers for their communities called cooperadores or cooperadoras. And these people are volunteers, and they work for their community, and they're trained by the Institute for Latin American Concern on how to provide basic health things for their communities. So this is like how to reduce your salt intake, because there's a huge diabetes problem in the Dominican Republic, and sugar intake. And then also part of their role with us was installing the water filters. And what we noticed was that the healthcare providers who had an engaged spirituality and who also used that spirituality with their campesinos and their communities had a much healthier communities. And the ones who were less engaged and who were kind of drudgingly doing their work had very unhealthy communities. Their water quality was poor. Only about half of the water was potable, which, as I said earlier, leads to much greater diseases. So that was kind of an interesting thing for me to notice. And I think that it's important, this kind of made me realize how important spirituality is, because these healthcare providers were able to not only understand the health that they were providing for their communities, but also understand how that healthcare impacted their campesinos in a more fully. So not only are they preventing these waterborne diseases, but they're also preventing the parents' children from becoming sick and potentially needing to go to the hospital. So seeing that contrast between the healthcare workers who had an engaged spirituality really showed me that I think it is important.
And I thought of two examples of two physicians that I'm colleagues with. Both of these physicians, their spirituality is nourished by their faith, their belief that God is in partnership with their life. So my first one was a surgeon who, prior to any of the surgery, stepped back and prayed with his team, prayed that they would do the best they can, that the hand of God would be in his hands as he performed the surgery and so forth. A second example, a family medicine physician who shared with me that as she's knocking on the doors at her clinic, that she offers a brief prayer, again, that she will be present for that patient, that God will, again, partner with her in her practice of medicine. So those were two quick examples.
One example came to mind that I shared in the breakout session, which was a physician who was a colleague of mine at Partners in Health. And shortly after the earthquake in Haiti in 2010, when it was really chaotic and there were just a lot of very severely injured people kind of in the streets, and the sort of response teams, some were there, but their supplies were really lacking. The National Hospital had collapsed and most of its staff had died. And it was really bleak. And this one doctor was with a group of expat surgeons who were attempting to do some basic surgeries just to help reset bones and whatnot. But they didn't have any supplies, and they got frustrated and started leaving, at least to go back to the whatever expat camp. And this one doctor said, he sort of insisted that they come back and they sit with these people if they died. And not just for random reasons, for the fact they were dying from the injuries that these surgeons could have tended to had they had the right resources. So it is an especially painful thing, first and foremost for the people dying and their families, but also for the surgeons to sort of have to sit there, not have to, but sort of be called and step up to being there in that moment with those people. And I think that was really a powerful way of, once again, sort of being with that brokenness and not necessarily just trying to sweep away sort of failure or inability to sort of do something, because that's not always possible. And I think in my own experience, people who can be courageous and comfortable enough to sit in silence and not necessarily do or say or provide anything, I think that also shows a tremendous amount of emotional or spiritual intelligence. And it's kind of, it's counterintuitive, especially in healthcare, in a profession that values sort of people being able to intervene and help and do something, or at least provide a logical, coherent answer. But for sort of these matters of life and death, especially towards the end, these questions sort of fall away. But I think there is value in sort of being there, even in those moments. So I would consider those examples of healthcare professionals who sort of have a very lived spirituality in what they do.
Thank you. The last question was, how can Catholic and other faith-based medical schools encourage spirituality as part of physician and nurse formation? Have you seen effective examples of this somewhere?
I would say that Creighton does a good job of this already. And something that I do at Creighton as part of the service trip core team is emphasize the importance of reflection, just based on your daily activities, be it just a normal day or a day where you experience a lot of difficult situations. And I think as a healthcare provider, you see a lot of difficult things. Yes, you have your standard people who have influenza, but you also see death and birth, and that's difficult. So I think what a Catholic or Jesuit or spiritual university of any kind can do is to encourage reflective practices, and that could be sitting with your other people in the room with you and engaging in prayer. It could be journaling, it could be meditation, it could be whatever you think is necessary for yourself. But I think that's very important. And I think something that Catholic University could do is create the space for that to occur. So in your M3 and M4 years, when you're going through your clinicals, or as a nurse going through practicum, having that space to reflect and encouraging it, I think would be very valuable. And I think it would also create the opportunity for healthcare providers to develop their own spirituality and more deepen it. So I think that would be helpful.
And I would agree with that. I think students particularly, I think, get a freedom of expressing their spirituality if they hear from, in this case, a nurse or physician, share their spirituality. So again, some specific things in terms of what this Catholic faith-based medical school does. Freshman year, there's a course called the Healer's Art, which is very much based on the physician's spirituality and how they tapped into their spirituality to get through good times and bad times. So students are allowed to hear the physician's story. Again, I think giving the students then the freedom and allowing our faculty physicians to remember and to do that intricate part of developing our spirituality reflection. We also offer a fourth-year elective, and the title of that elective is actually called Healthcare and Spirituality. It starts next week, and I'm fortunate to teach that along with one of our surgeons, and so her presence will be very much in terms of how she has tapped into her spirituality to perform any number of surgeries, to interact with any number of family members and so forth. But I do think you have to create the space, and I think you have to see some role modeling by your nurse faculty and your physician faculty.
Yeah, I think pretty much all the best options have already been said. Well, one thing that I'm thinking a little different context, but I think it would apply in this as well. At Partners in Health, we sort of started these discussion groups. Really, they were reflection groups, which as much as an institution can be sort of grounded in certain sort of like philosophical or spiritual underpinnings that orient the work, it's still the day-to-day of just sort of doing, seeing patients and doing all the logistics can sort of outpace that sort of coming back to and tapping into sort of the values that really drive and sustain that work. And so it was a period to not just like reflect on why are we here, what is our mission statement collectively, but also personally. But it was a chance to really share common or not common struggles and real challenges or threats to one's motivation. So we talked about burnout, we talked about anxiety and stress and whatever, and just being able to share that with colleagues, I think, is so crucial because it transforms from a personal problem to more of a universal reality. And I think, like Marsha was saying, having leaders sort of be part of that, that invites people to kind of open up and show their wounds as well, which I think, once again, kind of offers an opportunity to kind of to refuel in a way, which I think is very crucial because in healthy professions it can be there's lots of turnover. People, at least in the development fields in global health, unless people find creative ways and sustainable ways to really sort of refuel and tap into that moral and spiritual sort of energy that's driving them, that it can be really challenging. So that's some of my thoughts.
Thank you all for your thoughtful responses. I'd like to open it up for questions from you all for the next maybe 12 or 15 minutes. I want to give ourselves time to get back down by 3. So if you can just say your question, I'll repeat it so that the recording can get it on the mic, and then I'll give it to whoever you asked the question of.
Oftentimes I feel as if religion and spirituality get interchanged or used synonymous. How do you think the two are different, or is one needed for the other?
So the question is, oftentimes religion and spirituality get interchanged. How are they different? And how, what was the last part?
Do you think one is needed for the other?
Do you think one is needed for the other? Do you have a particular person you're asking?
No.
Anybody want to take it?
I know this is like theology 101. They like start with this, like what is the difference between spirituality and religion? So I don't have a formal definition, but I think, like Dr. Kelly was saying, spirituality has more to do with relationality, which is a much more expansive idea, and everyone, in that sense, we could say has a spiritual identity in how you relate to yourself, to others, to a greater source, or as Dr. Kelly said, ultimate. And that's universal. I think religion is how experiences of relationality become enshrined in rituals and habits, and more of a collective sense. It's usually, to talk about a personal religion, I'm just thinking of a book Thomas More just came out with one called A Religion of One's Own, which is probably more speaking of spirituality. We usually consider that to be more of a personal practice and identity. But to your second point of do they need each other? I think lately I think we hear a lot more about this identity type as spiritual but not religious, which I think has sort of become all inclusive of a lot of different things, and it sort of hastily kind of dismisses religion as just one sort of bulky thing that's a relic or anachronistic, and unhelpful or hindering even of spirituality and of a personal sort of spiritual identity. But I think that it's important to understand that in most cases our spiritual identities do build on traditions and are deeply rooted in them. And sometimes they're you can't really disentangle the cultural and the ethnic sort of lineages that, like my Irish Catholic, heritage isn't just about the Vatican, right? It's something much more multidimensional than that. So I think to acknowledge that religion can absolutely give more substance and sort of dimension to one's spirituality, but also to recognize that religion is not a static, monolithic term of, oh, this is what it means to be Catholic or Buddhist or Hindu or whatever, but to understand that that is also an amorphous term and even just a source of wisdom and teaching that strive to fundamentally explain ultimate reality and truth and what it means to live a good life. So to recognize that those are not siloed. It's not like you have to choose. At least that's my perspective, which is not to relativize all of them and just say, well, they're all just one and the same, but to recognize that I believe in plurality when it comes to spirituality and religion, not in exclusivity necessarily. So that's my take. Do you guys have?
The only thing I would add to that is, as I talk to students and so forth, I will say spirituality has been a part of humanity from the get-go. Organized religion has changed, over the centuries, over the years, and so forth. So again, and I would agree with what you said, every human being has some kind of spirituality. Some of it is rooted, and many of our spiritualities are rooted in a faith tradition. But to be human means you have a sense of spirituality. And if you go back to prehistoric times, people were trying to make sense of life in some way.
Thank you. Others? Please.
This question is for Marcia. As you're talking about that, and you talk about obviously you have lots of students that stop by and are struggling with different things. And when we're at different parts of our life, obviously we're closer or further away from our own sense of spirituality. And how do you help students tap into that? When they come in and they're not really sure what it is. And obviously you deal mainly with students that would be pre-med, so they're beyond 18 years old, but still, how do you help them tap in?
So the question was, as students come by looking for help and guidance, how do you help them tap into a sense of spirituality in your profession?
I think it's through questioning to really say back to a student and staff or faculty, well, how are you making sense of this? Why do you think this happened? How are you feeling about it? What are the choices that you feel you have? And do you know why you're making those sorts of choices? I think it's really, at least that would be my approach in terms of asking that person to tap into their own sense of meaning. How are they making sense of this? Now, based on, again, where they think their spirituality is rooted, people who believe in prayer will say that. And so then I think you have to be present for people, and I think you have to be willing to enter into prayer, enter into silence with people. But that's, kind of a quick answer. I think it's how are you making sense? Why do you think this happened? And what are the choices you can make, and what feels like the way you need to proceed.
I think one other thing that Marcia just reminded me of is just a quick experience when I was working in a health clinic in Los Angeles where I went to undergrad, and I remember my boss asking me one time, she said, it's kind of ironic that you're here helping these poor, uninsured Latinos when you're Catholic. Like the Catholic Church for centuries has marginalized these people and oppressed them. And even though that statement is kind of confusing because Latin America is the most Catholic continent in the world, but I think I answered, I said, I have 1,000 reasons to be ashamed of an identity label of being Catholic or white or relatively rich or American or male. I could reject all of those, right, because of the connotations. Or, which is what I think we do whether we like it or not, is we are constantly redefining what those mean every single day, and how, if only in our encounters with individuals, and what it means to be male or American or whatever. And I think that opportunity, I think, speaks to when somebody is wondering, well, I don't have a spiritual identity, or I don't come from, or I don't associate with any of those groups because I'm not one of them. I'm not a Christian. I'm not George Bush, right? But to understand that actually you can, not that to put so much stock in a label, but that you actually do perhaps draw from these deep traditions, and you can redefine those, and that can be an incredibly ennobling thing, and an incredible opportunity for people. So I think that might be a way of rediscovering, oh, I actually do belong to this larger story of humanity. And this isn't just something I pick up and choose and like put on like a piece of clothing. It's actually something that's kind of carried over in a story that I'm a part of and I'm writing. So, yeah. Thank you. Others, please.
As for you as a patient or as the family members of loved ones that have been patients, can you describe certain behaviors, that would be within interaction with the healthcare professional where you could walk away and say, geez, I really feel like that person may address more than just the physical dimension of what it means to deliver healthcare, whether that be emotional, spiritual, or whatnot. And kind of what does that look like for you as you're kind of looking at spirituality and healthcare and how it plays out?
So the question was, could you note behaviors that indicate to you that a healthcare professional has treated more than simply your symptoms, but has engaged you at some level of emotional, spiritual, that's deeper?
I'll start. I'll pass the mic. And I guess your question, how one knows if, again, there's more than just treating that particular illness. Again, it's the questions. How does this make you feel? How are you going to cope with this? Do you have support? There's a physician at GW, Christine Kulhowski, who's done a tremendous amount of writing on spirituality and healthcare. And pretty much that's what she would say. What kinds of support do you have? How is this affecting your life? Another wonderful thing to remember, I guess, particularly for physicians, is to never say there's nothing more we can do, because there's always something more you can do, and that is your presence. And so that in itself is power and powerful for the healing process, not necessarily the cure, but the healing. Specifically, as our physicians are trained, it's things like even being on high level with people, not looking down on them, gentle touch, knowing the person's name, knowing a little bit, remembering the person's history, and asking those questions, because this is, 42-year-old mother with 3 kids, and to ask kind of those personal questions about how is this affecting your life.
I would definitely agree with everything that Marcia just said. For example, I have chronic ear infections, so I work with one of the doctors at the Student Health Center probably once or twice a semester, which is unfortunate, but it's okay. And I think that the reason that I know that he's engaging in my spirituality is that even though I know this doctor has a massive caseload, there's always other patients to be seen, he's always willing to have a better understanding of how these infections are impacting my daily life, writes down the details that Marcia was talking about, not just my presentation of symptoms, but that I am a junior living with freshmen every day, things like that. So I think just the very basic things of understanding your patient or your community shows that you have that spirituality.
I'll just add briefly, someone once said, I forget what the average is or something, that health insurance companies want doctors to spend something like 9 minutes with a patient. And he said, there's a lot of ways you can use those 9 minutes. And I don't think it comes down to like maximizing your time and figuring out how to budget between the computer and like the history, whatever. It's not a technical thing. I think it's more about the kind of subtleties of body language, of language. I would say too, even just I've noticed an ability to really listen, even if it means like just turning away from the computer and just getting a full answer of really what is concerning you, not just what's your chief complaint in a medical sense, but like tell me your thoughts. And that you have to be careful. Some people want to talk for an hour. Some people can really get across what's most pressing in 30 seconds, and that's a pretty good use, if only to build that relationship and trust. So I think I would just say a lot of receptivity, in the sense of, instead of sort of you feeling like I gotta extract the vital information from this and I'm the one steering, to be a bit more dynamic with letting the sort of patient steer a little bit, and hopefully that can be instructive for you to really tease out what is the real issue here. Maybe there's something totally on the periphery that is actually much more central to the condition that you're addressing. So receptivity is important.
Thank you. I think that given the time, we probably need to move back downstairs. We should probably close it here. I want to thank the panelists. And just as a note, one of the things I was doing when I was sort of looking into the folks who were being panelists today is I looked up some stuff online, and Phil has a wonderful piece titled Measuring the Immeasurable, which I do recommend people take a look at. And it talks about his own experience and really about this ministry of presence that he's referred to throughout the session. So I've sent it to a number of people here at Creighton, and it's certainly worth reading. So, but I want to thank all the panelists for your time and energy and expertise, and you guys for coming. So thank you.